Good afternoon. I'm Ian
Oh,
Tomson-Smith, MD of Policing TV. And this afternoon, I am joined by Cath Pickles for the second part of our chat about Restitute and the amazing work Restitute and led by Cath have been doing for third-party victims of crime. So I think in our first part, Cath, we really did understand where you come from, how everything was set up, and the sorts of services you can deliver to the people that need them. And I was interested in this second part, investigating and looking at more about how the model works, how people find you, how organizations can get in contact with you, how you're structured, and then looking at the future. I believe there's a big conference happening in October. We'd
there
love
is.
to hear more about that.
Brilliant.
So for us, so we welcome referrals, we welcome professional referrals, and we also take self-referrals. The way to do that, now I understand Ian's going to be doing all the links and the whistles in the bottom. So basically, we have a referral form that we need you to fill in. It is relatively short, relatively simple. Ideally, we want referrals as early as possible after disclosure. And that's really important, because the quicker we can get in and start working with that family, the quicker we can undo some of those harms that are really, really going to kick in. So
what sort of person would be referring?
We get referrals from everywhere. We get referrals from serving police officers. We get referrals from the ISVA service. That won't surprise you. And from the SARCs. But there's no reason why a police officer who is either in the first stages of that investigation cannot tell the family about our service. And we need to be clear. The new ISVA guidance is saying that if you think that that family member might be a witness, and remember, a witness isn't necessarily a witness to a crime, but it could be because they're going to provide a character reference, or they're going to provide a descriptive service of the child, or where they were to confirm that they were where they said they were. They shouldn't be being supported by the ISVA service. They need somewhere else to go. It's in the ISVA guidance. So think about what you can be offering to that family straight away. The primary victim will benefit if they know that their family is being supported. They say, is my mum okay? Is my mum okay with me? They want their families to have support. So get those referrals in. They can literally come from anywhere in the system. They can come in as a professional referral, or you can tell them about us and they can self-refer to us. But the earlier, the better. The second group of police officers that I really want to reach out to are those who work in community policing, who are coming across troubled youngsters, particularly, or frequent runaways, or children who are often being reported missing. Those children are very likely, when you look back through their records, survivors of sexual abuse or violence, or domestic violence, or other serious crime. And what's happened is their needs weren't properly met, or their family's needs weren't properly met when that initial disclosure came in. And so they are now popped up through the system, usually as teenagers or young adults, and they have got tremendous support. They are still living at home. Their parents are still trying to take care of them, and they are on their knees. So that's the second point that I really want police to think about. And if you are contacted by someone who is dealing with a historic crime, then we can support those people who are now caring for that person as well. Because sometimes these historic disclosures can come as a tremendous shock. And it might not be the partner, it might be the mother. There's bound to have been some kind of family relationship in this. Bound to be. That's probably why it's historic, that people have been waiting for somebody to frankly die, or they've been waiting until other people are old enough to be able to deal with it. So at each point, think, how can I support the family? And how will that support the primary victim? Because the primary victim is not going to be able to manage this on their own. And that primary victim will appreciate that someone else is carrying the load for them, for their family. Yeah? So Ian's going to put the links all in the chat about how you do this. In terms of geographical reach, we can support anyone in England and Wales. We have 2 pots of national funding that allow us to do this. Yes, we are always at capacity, but we triage. We'll have a look. We'll see who's got something that's massively urgent coming up. Is there something involving family court? Is someone about to be released from prison? Those things can actually make a difference if you get the right support at the right time. So we will do that. You can do it from wherever you are. We do have specific pots of funding, and I would particularly love to be receiving referrals from serving police officers in Essex, in Bedfordshire, in Devon, and in Cornwall, because those PCCs are actually individually, as well as our national funding, are supporting us locally, which is what we need to happen with all the other 47 or 43, I can't remember, counties that there are in the country. So please, if you're from Essex, Bedfordshire, Devon or Cornwall, really, really want to prove to those PCCs that our work is needed and valued, because then they'll carry on for us, funding us. It's obvious. Strategically, we are campaigning to see if we can get to the stage where parents and carers of vulnerable people, so that's not just children, but adults who've got mental health issues or learning disabilities or those kinds of things, where their carers are actually recognised as victims in their own right. And this is really important for primary victims, because I think that one of the reasons that people take such a long time to disclose is that they can envisage a bomb that's going to go off. They can envisage that their family life is going to explode. What they can't envisage is, by not disclosing, how much harm they are doing to themselves in terms of poor educational outcomes, poor mental health, carrying this weight on their own, relationship breakdown and family breakdown. And that's really, really hard for someone to imagine what that's going to look like in 10, 15 years' time. So get those. If we can start saying to people, there is support for your family, this bomb is not going to cause as much harm as you believe it is, because we've got these services ready to support these families, then maybe some people will find it easier to disclose more quickly. That makes sense?
Yeah.
So can I bang on about my conference now?
So yes, the conference. October, 17th of October, Stansted.
Yes. So this is a classic case of be careful what you ask for, because you might get it. So I put a shout out to various different people, starting off with Jackie Long at Channel 4, who I met a few years ago when we did an interview with her. And first rule of thumb of anybody who's running any not-for-profit organisation is always get people's telephone numbers and never lose them. So I had Jackie's number. I sent her a message and I said, how many kidneys would I have to sell? I literally said this to her. How many kidneys do I have to sell to get you to come and host my conference? And she said, none. I'd love to do it. So I know. So Jackie Long is hosting it. I've got the Chief Constable. Let me just run through some of these people. I've got the Chief Constable of Essex Police coming. I've got the PCC from Devon and Cornwall coming. I've got Jess Asato coming, who is a real specialist in domestic violence and abuse, who's an MP. I've got Caroline Noakes, who is now the Deputy Speaker. She's going to do my closing plenary speech, just reflecting what she's heard and her experience, and I hope she's having to be really, really careful because she's now the Deputy Speaker. I've got Sal Brinton, who is Baroness Brinton from the House of Lords, who has long campaigned for better supports for victims' families. And then I've got forensic psychiatrists. I've got former chief nurses. I've got Joe Finch, who is the professor from the University of Suffolk, who helped with our research project, which has really made such a huge difference on a strategic level. It is going to be amazing. It is going to be extraordinary. And it's not just one of those conferences where people bang on, clap, sit down, next person comes on. It's not one of those conferences at all. It's actually, hopefully, if everything goes to plan, a really structured activity, learning-based day. The huge majority of the speakers and presenters are going to be staying for the entire day. They will become part of the audience. They will be sitting on the tables and they will be taking part in the activities that we do. I'm not going to spoil it. because if I spoil it for you, you won't get it. But it starts with a bang, and then you're on this roller coaster throughout the day. It's scenario based. It is the most fantastic learning experience for anyone who's working with these families that you can ever imagine. Ian's going to be really nice. He's going to put all the links in the chat for me. But
I will, yes.
The feedback that we had, we did this conference 2 years ago in Norwich, and people came out, well, some of them were crying, I'm sorry to say, but they were. Others came up to me and told us that it was the best conference that they have ever been to in 20 years. Everybody walked away with such a huge understanding of the opportunities. And in the last 2 years, if you look at the way that the referrals for Restitute have changed and grown, the areas that we are now covering, my hope for the conference is that I'm going to be creating a small army of people who are going to go back into their professional backgrounds, who are going to be championing parents, helping parents to feel better about themselves, and who are actually going to be referring to us.
And one thought, I mean, that sounds fantastic, Cath. Well, one thought I had, just going back a little bit in terms of the referrals, do you need to have some form of certification, or, I mean, this is the sort of thing that underpins your relevance, but as an organisation, for police to be able to refer to, do they need to know, about you, but do they need to know about why they are able to?
Right. Okay. So let's just cover some of my credibility. So we get funding from the Home Office and from the National Lottery, just focusing on the Home Office. So we are officially providing a service that the Home Office approves of, which basically, yeah, I mean, if anyone wants to know about my policies, my procedures, honestly, it's a deep dive into
It was more just a thought process. If somebody's thinking, okay, yes, I want to, this family needs help. I need to find an organisation. Is there sort of a national stamp that organisations like yourself can have? I mean, funding from the Home Office should surely be enough. But just to give people the confidence to do that.
So we are members of the Survivors Trust. We are. So we're involved with them. My support work staff all have the appropriate safeguarding. They're all mental health first trained. Many of them, as well as being third-party victims of crime themselves, have taken on additional qualifications or had pre-existing qualifications. 3 of them are retired social workers who I've dragged back out of retirement, who lead the support work service. And the quality that we are able to provide is constantly assessed, monitored, fed back on. And I think the research project, which was an evaluation of our service that was carried out independently by the University of Suffolk, if there had been anything in there which said there's something that needs to be done differently, there were a couple of things, but if there had been something which we needed to change, then they would have flagged it. And that report has gone to the Home Office, it's gone to the Ministry of Justice. Yes, technically, anyone can set up a service. But if you want to do it and the way that we've done it, at the scale that we've done it, one of the things that I knew straight away is that we needed to make sure that our quality and our credibility was literally A1. Because, we're asking professionals involved in law enforcement and social services, people with registered qualifications, to refer to us. We need to be able to match their credibility and then some, and we do.
Fantastic. Well, it sounds like you're doing an amazing job, Cath, you and all your team. And the conferences should hopefully provide a platform, a springboard onto further services. You're just UK based at the moment.
We're just UK based. However, one of the things that has come out of the Home Office, which is really interesting, is that the Crown Dependencies are looking at what we're doing as a way of matching our model. And if anybody would like me to come and visit, consult, support in other areas, I am more than happy to help start them thinking about how to build this properly from the start that doesn't involve, I'll just send them for therapy.
Great. Thank you ever so much for your time, Cath. We will put all the links in the blurb at the bottom of the video for the referral forms, the event, which we really do hope to be covering on the 17th of October. Mark your cards. And Cath, it's been a pleasure. Thank you very much.
Thank you.